Live on WFLA now. Feel good and live your best life with Bloom Health Club. Here's Gail Guayardo.
Welcome, everyone. I'm Gail Guayardo to our streaming show, the Bloom Health Club. Now, one place often overlooked when it comes to our strength is our pelvic floors, which is unfortunate because it's linked to so many things. And there is a huge movement right now of people turning to pelvic floor health therapists to get them kind of up and running. And this has everything to do with your sex life, your overall body health. We've got a really special guest for you today. She is known fondly on social media as the Down There Doc, and she has helped so many people improve their pelvic health. Why can't I say that? Pelvic floor health. It's like a tongue twister for me. Our guest today is Dr. Marcy Crouch, who is a board-certified women's health physical therapist. Thank you so much for joining us.
Oh, thank you for having me. You know, I love talking to you about this stuff. So
it's so good. And we really need to be talking about this. I want to, introduce you to our producer of Bloom. She's going to be switching the show today and throwing in
Dr.
some
Marcy.
questions.
Good to see you. Great to have you on the Bloom Health Club.
Thank you. Thank you.
So, Dr. Marcy, I have learned really just this past weekend from a dear friend of mine that pelvic floor therapy is a game changer. Mm-hmm. And I'm the last of the party. I've had four kids. If somebody needs pelvic floor therapy, it's me. But because I don't pee when I cough, I'm like, I'm good.
Yeah, I know. It's a common story. I think pelvic floor physical therapy is not well known. It's not a standard of care for women. And I think through history, there's a lot of conditions physically and mentally that women deal with that are often ignored, or we're just told that it's normal, it's just part of aging, it's just who we are as women and mothers. And when we're really looking at long-term effects of pelvic floor dysfunction, we're seeing a huge impact on every single aspect of a woman's life: physical, work, emotional, intimate, all of the things. The pelvic floor we can kind of trace back to.
So speaking of history, talk to me about your own personal journey. You've shared that you have had a traumatic birth experience. Talk me through that.
Yeah, so it actually wasn't me. So I've been doing this for 15 years. So I have heard and seen lots of traumatic birth recovery. I mean, this is like my bread and butter. Not too long ago, in March, my older sister had her first baby, and she had one of the worst delivery experiences I have seen in my career.
Wow.
And I'm very grateful that I have a lot of medical colleagues throughout the country and internationally, and every single one of them was texting me and saying, what is happening? Because I put it all on social media.
I watched you. I mean, you were really traumatized by this as it was your sister, and you couldn't believe it.
Oh my gosh, I know. And I, flew out there. She's on the West Coast, I'm in the South. And I have seen this. It's not new information for me, but from a personal standpoint, to see it happen in real time and to actually hear what was being said to her and what was happening, I still cannot even fathom it. So it is that kind of really solidified why we need to change systemically. Not new, to me, because I've been doing this for, a bajillion years, but it really solidified the fact that I was like, holy moly, this is bad news. And it's happening to women every single day in every single city.
Yeah. It's so whether you're a woman that's given birth or had a traumatic birthing experience, which I will tell you, I had one of those too. And you talk about, I don't want to get too graphic, so I'll just say I've had one myself. But yet I've never been told, Gail, you probably should go to, a pelvic floor therapist. So kind of walk me through it from what my dear friend told me.
Sure.
There's an exam involved, and there should be. I mean, how can you diagnose? How can you work with somebody unless you are going to a licensed therapist who is skilled at doing this?
Yeah, absolutely. It's such a good point. And I think there's kind of two things to talk about on that side of things. So physical therapists are really the best people to be down there. I mean, we're musculoskeletal people. We're injury prevention people. The pelvic floor is muscle. It's a group of muscle. It works for us every single day. So the fact that there is not a standard of care for pelvic floor recovery or even injury prevention is just insane to me, when we spend the same amount of time and resources to make sure that, we're not tearing our ACLs on the soccer field. You know what I'm saying? So, and to me, call me crazy, I feel strongly that being able to hold in urine, gas, and stool every single day is a little bit more important than like not tearing your ACL. I mean, just me.
It's critical.
Yeah, I mean, it's every day. Yeah. And so I think us being kind of the best people to be in there, you can specialize as a physical therapist in women's health, pelvic floor dysfunction. And a lot of times, physicians and other medical providers, and through no fault of their own, other that they're not getting this training, they don't know that, and there is no standard. And now the literature and the evidence is coming out to support what we're doing. It's safe, it's cost effective, it prevents a lot of problems, it gets patients off of their already very busy schedule, and it's pretty much appropriate for everybody through the lifespan of a woman. I'm talking like starting your period all the way through going through menopause into our older years. I mean, we're seeing high school girls and women have leaking and pain when they're in teenage years. Can't wear tampons, can't have exams, leaking when they're playing volleyball. And that's not even related to pregnancy or postpartum.
Wow.
Yeah.
That's pretty remarkable, because when you think,
I mean,
Sarah?
that's really scary. Even just thinking about, I'm 25, full disclosure, and thinking about not being able to even put a tampon in.
Oh, I have tons.
That's scary.
Oh, 100%. Yeah. And they're just like, nobody teaches them about anatomy or how to put a tampon in, or that it shouldn't hurt. I've had so many young women come to me and they're like, oh yeah, I've just never been able to wear tampons. And like, it just pushes itself out and it hurts, and like, I can't wear it, and I can't, have an exam and all these things. I'm like, this is a daily activity. This is not, like an elite athlete. Like, I'm talking like this happens every month.
Wow.
Like, we need to do something about this.
So you're doing it through therapeutic moves, through teaching people, which, we're going to be talking about here soon, but it is all about becoming one with your pelvic floor, something that most of us just forget about. I did.
Yeah. And I think it's really poignant what you said, Gail, too, about like becoming one with it, because we don't see those muscles. Okay. Like, we can't look at our bicep, right, and say like, oh yeah, like this is how I make my arm move. But when we're talking about the pelvic floor, it's inside, and we don't talk about that area of our body anyways. So why would we even talk about the muscle function? I mean, I didn't even know there was a pelvic floor until I was in grad school. And that's how I got obsessed with it, was that we were talking in anatomy, and the professor was saying, oh yes, this is when I'm getting my doctorate in physical therapy. Like, she used an example of a woman tearing during childbirth. And I remember just staring at that anatomy picture, and like my jaw dropped and I started sweating, and I was like, what do you tear? What are you talking about? Like, I had no idea. And I was 25. Yeah. But it's like, I had no clue, but it's happens to everybody almost.
That was going to be my traumatic birth story that I was going to share with you. Okay, if you are watching the Bloom Health Club right now, we're going to show you some physical therapy techniques. If you're listening, Dr. Marcy knows to go into great detail when it comes to the description of what we're looking at and what you need to be doing. So talk me through this one. This is where you start, the pelvic floor engagement.
Yep. So I call this the foundation. Okay. So I want you all to think about this as like pouring cement for your house. This is how you engage your pelvic floor correctly. And I like to start laying down, feet flat on the ground, knees up. So we're taking out gravity and all these other extra, difficult things. And you break this down into 3 movements. First is an exhale through your mouth, like you're blowing out a candle or fogging up a mirror. Okay, this is going to help engage your diaphragm, and your pelvic floor, which is at the bottom of your pelvis, works together with your diaphragm. Okay, so it's easier to get a pelvic floor contraction when we're talking about strengthening when we add in an exhale. Okay, so we're doing exhale through your mouth like you're blowing out a candle, okay, or fogging up a mirror. Then you're going to bring in your lower abdominals, kind of like a corset action, okay? Not squeezing, but like just a very gentle kind of drawing in, thinking about bringing your belly button together. Then you're going to add in your pelvic floor. So this is where you're trying to hold in urine, holding gas. I say pick up blueberries with your vagina, like gentle, not make jam.
Let's unpack
Yeah.
that. Picking up blueberries,
Pick up blueberries with your vagina.
I don't understand that.
I feel like there's a bumper sticker in there.
Yeah, I mean, trademark.
Yeah, you should trademark that.
I have lots of other trademarks. So this is where like you're doing a contraction with your vaginal muscles. Okay, so think about like you're trying to stop urine or gas. Okay, so do it right now. I won't tell anyone. Okay, so the contraction is in and up towards your head. So when you're contracting your pelvic floor muscles, they come into the vaginal canal and up. So it's like you're drawing up a blueberry, you're drawing up a smoothie through a straw. You know, you're not going crazy. Like we're not making jam, but we're just drawing up with your abs and your breath.
Okay, I'm trying.
Okay. Yeah. Nothing
right.
here, Gail. Nothing here.
Blueberry season in the Bloom Health
Yeah,
Club. All right, next up, heel slides.
Okay, so this is taking the foundation one step further. Okay, so any core exercises that you're doing like these heel slides, for example, will not be as effective unless you have those three things in place from prior. So it's the same setup, on your back, feet flat, knees bent. You engage your foundation, so breathe, bring in your abdomen, pick up your blueberries, and then you're going to just very gently straighten out one leg at a time. Okay, almost like you're kind of doing like a, I don't know, what would you say? Like bicycle, seesaw?
Yeah.
Kind of
Like maybe
situation?
elliptical situation.
Yeah, there we go. Love that for us. Okay, nice and slow. And you want to think about through every movement of your knee and your ankle and your hip that your pelvic floor and your abs are engaged at the same time. And that's what's really driving that contraction. Don't hold your breath. Don't do this with your face. Your pelvic floor is not
I must
connected.
have been doing that just watching.
I know. Everyone's like, am I doing it? I'm like, I don't think your pelvic floor is connected to your jaw. So no.
I love it. All right, the next one is squatting. You teach these moves, but you say we have to learn to engage our pelvic floor in all aspects of life.
Correct. So it's really important to build your foundation on the ground, okay? But then that has to transfer over up into what we call functional activities or activities of daily living. So I like to do a wide base of support squat. This is kind of like a plie, okay? So if you've taken ballet or anything like that, I want to make sure that your pelvic floor can still work for you while your legs and your glutes and your arms are in different positions, because that's life. We don't live like this. Like we have to be able to move in different planes, and your pelvic floor has to be able to learn to come on and meet those needs. So same thing when you're bending down, doing a squat or lifting something heavy, you're going to do your foundation and you're going to engage your pelvic floor, pick up your blueberries. If you get down to the squat at 90 degrees and you don't know if you have blueberries, grab them again and then drive back up.
I like that.
You're going to build the fitness when you don't know.
I had the opportunity to try these movements, not the plie there, but close to it, kind of like a squat situation. And you forget to pick up the blueberries a lot. You disengage your pelvic floor. Every other muscle knows how to activate in your body because we work out all the time, but we do not work out the pelvic floor. And it's attached to everything, our overall health. It's the core. It's the, and I want to hear how it improves our sex life.
Oh, it's my favorite topic. Yes. So the first layer of the pelvic floor muscles, the pelvic floor is broken up into three. The first layer, the most superficial layer, is attached to the lateral sides of the clitoris. Okay. So when a woman orgasms, has a climax, we have that like rhythmic contraction. Okay. That is partly from those muscles. So a lot of times what we see when women have difficulty with climax or even pain with climax or difficulty with penetration, that first layer and even the second layer can be dysfunctional in some way. Okay, so like if you have a very tight muscle, like a spasmy muscle, and you're trying to get it to contract, you're not going to have a strong orgasm because the muscle's already there. You know what I'm saying?
Right.
So like, and that will cause pain. It's like having a Charlie horse in your calf.
Yes.
And then doing calf raises. Like, ow. Yeah, ow.
Gotcha. All right. This is all very interesting stuff. Okay, Dr. Marcy, we have a few viewer questions that we want you to answer.
Okay.
Some folks have sent it out. We're putting this out on social media. And this is the first one. Dr. Marcy, can learning to hold your pee make your bladder stronger?
Oh, it's such a great question. So The 2-second answer is it depends. Okay, so yes, in terms of if you are leaking urine and having a lot of frequency and urgency. Okay, the bladder itself is a muscle. It's a different type of muscle, but it's like a balloon. Okay, so if you can train your bladder to hold more urine and the pelvic floor can meet that demand, then yes, you will leak less and have longer what we call voiding intervals.
Okay.
What about people that don't have kids yet? Are there pelvic floor exercises you can do before planning to become pregnant?
100%.
Are these the same ones that we're talking about? Are there other ones?
Yeah, but yes, to all. Yes. So anytime you're thinking about strengthening your core, getting stronger in your hips and your pelvis, that's all pelvic floor related. So if the intent is to get ready for childbirth, there's a ton of studies that show strong pelvic floors help support with postpartum recovery. Okay, but this is a very important distinction. Okay, I'm going to my grave here. Strong and tight are two different things. Okay, and pelvic floor muscles do not push a baby out. Kegels do not push a baby out. Pelvic floor muscles have to go away. They have to get out of the way. They have to stretch and they have to lengthen. So if we're doing pelvic floor exercises specifically to get ready for pregnancy and delivery, there has to be a balance of those two. Okay, we see more trauma, tearing, instrumental delivery, harder recovery when pelvic floor muscles are too tight and the person does not know how, either because the muscles are too tight or just from a motor control issue, to bear down and to get the muscles out of the way.
Okay.
Does that make sense?
Very much
Yeah.
so.
Okay.
Very much so. All right. We have another viewer question. Someone asked, I'm planning on having surgery for my condition. Why would I need pelvic physical therapy?
Love that. So my assumption is that the surgery is like hysterectomy, prolapse repair, something of that nature. So just like you would have physical therapy prior to knee or shoulder surgery, pelvic floor physical therapy prior to pelvic reconstruction, prolapse repair, perineoplasty, hysterectomy, whatever the case may be, will improve your outcomes for surgery. Okay, so you will have better outcomes because you're going into the surgery stronger and with better motor control of your pelvic floor. Okay, just like we see people that are having ACL reconstruction for their knees, they are in rehab up until the day before surgery, and we see them in physical therapy the day after surgery. Like they're still
Wow.
like I have my soccer, when I was doing residency and working female athlete, my soccer players came in the day after surgery. And we start doing rehab immediately.
That makes sense, though.
Yeah.
It's so simple.
Yeah.
It's so simple, Sarah. So yes, you need both. And obviously there's like some outcomes with surgery that we can't control from a physical therapy side of things, like, genetics and how you respond to the surgery. But from a musculoskeletal standpoint, those are variables that we can manipulate.
Okay. So someone asked, how often will I need treatment?
It depends. For what?
That's true.
Yeah.
It depends. It's just like everybody's different.
Yeah.
I could see the same diagnosis, let's say, leaking urine, we'll just say vanilla stress incontinence. Okay, leaking urine, laugh, cough, sneeze. And I see one person that has that and their pelvic floor is very low tone. Okay, prolapse, organs are sitting a little bit lower in the vaginal canal. When I do exam, I just kind of keep going. Like there's not a lot of resistance in the muscles. Okay, that needs strengthening and up training. I see somebody that has the exact same thing. Okay, leaking urine, laugh, cough, sneeze, and their pelvic floor is very short and tight. They don't need strengthening. It's not a strength issue. So that is going to be more focused on lengthening, releasing tension, improving contraction, motor control. That might be quicker than the strengthening, or the strengthening might be quicker. So this is where, to go back to your point in the beginning of this conversation, Gail, about getting an assessment and having somebody understand what the root cause of the problem is imperative to successful treatment. Imperative. And that's why when people say like, oh, just do Kegels, 100 times a day, it's not going to work because maybe you're not weak.
Right. Now, I want to go back to a question that I kind of pitched at the top of the show today, and that is hearing a firsthand account from a friend. She didn't go into detail as to why pelvic floor therapy was such a game changer, but I got a lot of wows. Like, you can't imagine what I don't know or what we don't know, and the changes and the and she just feels better overall going through the therapy. So what's the secret sauce in all of this?
I know the secret sauce. It's so interesting because that response that she had that you're sharing is very common. And it like makes my heart happy, but at the same time, it makes me very sad because it's not that complicated. Like what we're doing, it's not that complicated. But I have had so many patients, like runners who have had chronic hip and back pain that have never figured it out, people that have been like leaking pee for 15, 20 years, people that have never had babies but have chronic pain and they had, like endometriosis or whatever. And we do therapy. It's a combination of manual therapy. It's a combination of exercise. It's a combination of functional movement training. It's a combination of, I'm just going to teach you how to poop. I'm going to teach you what position you need to sit in to poop, and it's going to make that whole situation a lot better. And it's so easy. And I remember I had one patient not too long ago. She was riding her bike in my neighborhood. I saw her in, small town, and she was like, oh my God, like yelling out. She's like, Dr. Marcy, look, I'm riding my bike. She's like, I want to kiss you on the mouth. And I was like, all right, girl, come on. It's just these little things that make such a huge difference. And it's the missing piece that people have been suffering from for a long time.
Dr. Marcy, when you're talking about a physical exam, when you're talking about working with somebody, you need to go to someone like yourself. What kind of resume should we be looking for when we're trying to find a physical therapist? Because I know you're out of the Atlanta market. You have a huge following on social media as the Down There Doc. So definitely log on and check that out. But when people here in the Tampa Bay area and beyond are looking for a pelvic floor therapist, what kind of questions do they need to ask?
Yeah, it's a great question. So I would find somebody who is a physical therapist. Nowadays, we're doctors of physical therapy. There's a certification that I have. The letters behind my name are WCS. That's Women's Clinical Specialist. That's through a board. It's like being a board certified, OBGYN or, whatever. Not all physical therapists have that. It's not necessary, but that just identifies us as somebody that's specializing in that. There are other continuing education courses that PTs will take. So look for, it's called CAP OB, CAP PFM, which is pelvic floor. And then you can always go to the APTA, which is American Physical Therapy Association website, and locate a PT. And you can put in your zip code, and then a lot of the women's health providers will have their information, and you can find somebody that way.
Sarah, any questions for Dr. Marcy before we sign off?
Yeah, I want to kind of circle back to some of the stuff we've been talking about, but what are some daily habits that maybe we can implement right now to help the pelvic floor? Like, is it posture? Are we sitting wrong? Talk me through some of that.
Yes, everything. All the things. Okay, so here are my two. This is a secret. Okay, this is going to change your life. Okay, do not blow your nose while you're on the toilet. Don't do it. Okay.
I don't, so check.
I do.
You do?
I do.
No,
because there's toilet paper right there. I'm like, I got everything I need.
Okay. Yeah, don't. No.
I'm comfortable.
We'll give you a pass. We'll give you a pass.
Okay,
but from now
moving
on,
forward,
all right.
I don't want that. So no blowing your nose when you're on the toilet. If you have to have a bowel movement and it's not coming, do not push and strain, and don't do it with a closed throat. If you have to push or strain a little bit, do your blowing out. Fogging out a mirror, okay?
Okay.
And then just like chill a little bit. We don't need to like punch. Other thing, don't hover on public toilet seats. I know. It's a big one. It's a big ask. I know, but put a little Lysol spray in your bag.
Yeah.
Like wipe it down, put the thingies on.
That's a good one.
I know.
Just pop a
hard
squat,
to hear,
Sarah.
It's hard.
Just plant yourself on that public toilet.
Just sit down. I mean,
do it.
If we can do it 80% of the time, I'm fine with it. All right.
Okay.
If it's a disgusting one, of course, no. But we're not hovering.
That's why porta potties are no go.
Just go in the bush.
Yeah.
Yeah.
And I'll come bail you out of jail, Sarah.
Thank you.
Dr. Marcy, you're so awesome. It's been so much fun to have you. And again, follow her on social media on the Down There Doc. And of course, you can watch our streaming show, The Bloom Health Club, anytime on YouTube and BloomTampaBay.com. And you can find us through the CTV app on Fire TV, Apple TV, Samsung, and Roku. You can also listen on Spotify and Apple Podcasts. Thanks so much for joining us.